Good afternoon, everyone. Thank you for being here. Hopefully you've enjoyed the weather a little bit in a safe way. We'll get into that in a little bit. We took Saturday off because the weather was supposed to be better Saturday than Sunday for a break. We were wrong. So certainly, hopefully everybody's getting some yard work done around the house in a safe way, taking a walk. Unfortunately, we have lost two residents to COVID-19 over the last 24 hours. One was an African-American woman in her 60s. One was a Caucasian male in his 90s. Again, both had significant medical conditions. We've now lost 36 individuals who have died related to this illness, basically in the last 30 to 35 days. When we look at who has died, 27 Caucasian, 4 of another race, and 5 African American, 22 females, and 14 males. Certainly, as a community, we mourn the loss of life and are thinking about their families in this time of unprecedented time of grieving and really not being able to grieve the way that we normally do. Another stark reality of the virus that it preys on our vulnerable, and even though you make progress each day, we're continuing to lose some of our neighbors. When we look at cases, a reminder, we've done the most robust testing that there has been since we started. We've received hundreds and hundreds of tests back. We know when you do lots of testing, you're going to get positives. So we are currently at 1,047 cases. This is up 53 cases from yesterday. We'll get into what the 53 cases are and some of the stories that the cases are telling us in a minute. We now have 41 individuals in the hospital. This is up 5 from yesterday. This is a moment in time. Right now, many of our cases have been related to senior living facilities, nursing homes. What has happened is many of these facilities have sent folks to the hospital that were either asymptomatic or their symptoms did not deem to be in the hospital. So we're working through right now with our hospitals and our nursing homes in giving guidance as to handle this. A lot of these nursing homes overwhelmed by the amount of new tests. A lot of the senior assisted living facilities overwhelmed by just the positives. Again, we found a lot of positives. So we don't expect this number to stay at where it is right now. Many, over the last 3 days, there's probably been about 2 to 3 individuals that have gone to the hospital that really shouldn't have gone to the hospital. So this number, we'll have a better understanding of this, but certainly the increase in hospitalization rate is from this. When we look at those in a critical condition, we have 9 folks in critical condition. Again, let's think about them and pray for them. Essentially, if you're in a critical condition, you are in a position where you need help to breathe. About hospitalizations, I just want to share this number. We've had 126 people who have gone to the hospital that have been released. So people that went to the hospital for a period of time and got better. Today we have 610 people who have recovered. That's our green curve. That's up 2 from yesterday. Remember, on weekends we have less people working than during the week, so recoveries always get better during the week. So we'll have more recoveries during the week. But when we look at our story right now, 1,047 positive cases. That's the red curve. That is 0.22 of our population. So we need to keep that in perspective. When we look at our yellow curve, 401 cases. This is up quite a bit from yesterday. Reminder, out of our active cases, our yellow cases now, 70% are senior living related or contact cases. We're going to go into contacts a little bit. But those are household contacts that we are now seeing kind of an uptick because folks who are in quarantine maybe have not been following the rules as much as we need them to be, or folks who are in isolation within their own household have been a little bit too active related to other members of the household. So we're seeing more contacts really than we'd like to see. So when we look at the household contact number, 136. So out of our 1,047, 136 are household contacts. That's up 12 from yesterday. So 12 of our 53 cases today are related to household contacts. This is good in a way because we don't have to go investigate. These are folks already in a quarantine. We anticipate this to be there. Certainly it's bad because we think that maybe some of these folks now could have been non-COVID positive. So those are things that we got to just remind people. When you're in isolation, we really need you to be isolated in the house, or else your family members could get this. And we've seen more and more of that, even though it doesn't hit us with our medical infrastructure, our health department infrastructure is hard. It's still now a positive case that we need to track and get through to a recovery stage. 19 of our new cases are affiliated with senior living facilities. So this is an ongoing trend. We go out, we're doing proactive testing. The state's doing testing in nursing homes. We're doing testing with nursing home employees, assisted living facilities. Where did we start? We started really with areas where we knew there was cases. We knew we would find asymptomatic folks or low symptom folks. That's what we've done. We found them. Why is it important we did this now? Because we're minimizing the risk to our most vulnerable population. What would have happened if we aren't doing this? Our cases would look lower, but 2 months, 3 months from now, there would be deaths that we would be tracking back to COVID-19. So we're getting in front of this. We're saving lives, doing the responsible thing. So again, out of our 53 new cases, 31 of them are related to senior centers, senior living facilities, not senior centers, senior living facilities and contacts. 22 are related to community spread. So that is 2 days in a row where we went back really to last week's, 2 weeks ago was that kind of average around 19. Last week our 7-day average was about 11 for community spread. What does this tell us? It's a little too early to tell. Certainly that's a manageable load for us, but we're kind of going backwards. So when you go back 7 days, if you look at a 3 to 5 day incubation period with the virus, and then maybe give yourself 2 days for turn times on testing, you look back last weekend, we had nice weather last weekend. So that means we should be concerned about what these numbers might look like for community spread next weekend. So as we get more data related to community spread, we're looking at trends. Again, we had a great 7-day rolling average. Now we've got a couple days where higher. Maybe we'll get a reprieve on that in midweek, and we'll start seeing them go down a little bit more. But certainly, I think one of the realities is we're living with the virus now, and we're going to have to figure out how to live and still respect the virus and still try to physically distance. When you're at the store, wear a mask. When you're going out and about and you're being around people, wear a mask. It's really for their protection as much as your own. When we look at the number of folks we have in isolation and quarantine, about 1,100, up a little bit. We've had a couple days of higher caseloads. Many of those were already in quarantine, but certainly 21 and 22 community spreads more than 11. So that means your quarantine numbers are going to go up more contacts. When we look at who has been infected, 596 female, 451 male, 32 under the age of 19, 177 in their 20s, 133 in their 30s, 139 in their 40s, 172 in their 50s, 158 in their 60s, 106 in their 70s, 87 in their 80s, and 43 in their 90s. 20% are under 30, 33% are under 40, 46% are under 50, 62% are under 60, 38% are over 60. When we break down the municipalities, City of Syracuse, 519 total cases, 250 people have recovered, 261 active. Town of Clay, 92 total cases, 69 recoveries, 23 active. Town of Onondaga, 74 total cases, 28 recoveries, 46 active. Town of Manlius, 57 total cases, 38 recoveries, 19 active. Town of DeWitt, 54 total cases, 33 recoveries, 21 active. Town of Salina, 44 total cases, 33 recoveries, 11 active. Town of Camillus, 38 total cases, 29 recoveries, 9 active. Town of Cicero, 40 total cases, 29 recoveries, 11 active. Town of Geddes, 34 total cases, 21 recoveries, 13 active. Town of Lysander, 29 total cases, 18 recoveries, 11 active. Town of Pompey, 22 total cases, 20 recoveries, 2 active. Skaneateles, 15 total cases, 13 recoveries, 2 active. Van Buren, 7 cases, 3 recoveries, 4 actives. Town of Lafayette, 4 total cases, 2 recoveries, 2 actives. Marcellus, 5 cases, 4 recoveries, 1 active. Atisco, 5 cases, 4 recoveries, 1 active. Elbridge, 2 cases, 2 recoveries. Fabius, 2 cases, 2 recoveries. Spafford, 2 cases, 2 recoveries. Tully, 2 cases, 2 recoveries. Related to testing, certainly the information we get on the weekends is a little bit less clear, but we'll work this out for you. So far, we've had 13,367 tests administered. 12,893 of the tests have been returned. This is where we get our 1,046 positives. And since Friday, let's see there, we've had 1,047 positives, but we've had 1,046 tests returned since Friday's press conference. So we got a ton of tests back, and that's why you've seen over the weekend the numbers increase. There have been 1,047 positive, 11,846 negatives. We have 474 pending tests. This is down by 356 since Friday. Because we're doing so much proactive testing, the number of pendings is going to remain higher. We sent 690 tests since Friday. That's a lot of testing that we've been doing. And so basically our percentage, 8.1% of the results we received are positive. Now, the negatives from nursing homes are not in this number, so that 8.1 is probably a little bit less, probably around 7.9 for all of our fellow statisticians. But essentially, we know that consistently out of the number being tested, we've been somewhere between 7.5 and 8.1. And so let's just look at the numbers. 474 pending tests. We know essentially you got another at least probably 40 cases there. So the key is you identify, you isolate, you track, and you quarantine. You box it in quickly. That's going to be our reality moving forward, especially on a restart. These sunny days are probably good indications of what regular days will look like moving forward. We'll have more people together, more people interacting, and that will create more opportunities for the virus to spread. We need to be able to work off of this kind of workload moving forward, and we will. Gaps in the investigation. I'm going to give you some gaps right now. We said when there's gaps in an investigation, we'll share them with you. We have 2 instances where we have gaps and have issued a press release. One, an individual who shopped at the Walmart store at 6438 Basil Row in East Syracuse on Tuesday, April 28th, between 10:30 and 11:30. That's Tuesday, April 28th, 10:30, 11:30, East Syracuse Walmart. This individual is tested positive. This individual was not wearing a mask. 2, a passenger on the Greyhound bus, schedule 0206, on Monday, April 27th, that left the Port Authority in New York City at approximately 2:30 p.m. and arrived in Syracuse at approximately 7:40 p.m. This person did test positive for COVID-19. This individual is not a county resident, but was on that bus. This individual was wearing a mask. All passengers on this bus are being advised to self-quarantine for 14 days from potential exposure and monitor their symptoms of COVID-19. These individuals should call their healthcare providers to see if they should be tested. Okay, so one, if you went shopping at Walmart, Tuesday, April 28th, 10:30 a.m. to 11:30 a.m., there was an individual in the store who tested positive for COVID-19 who was not wearing a mask. That does not mean you had contact with them, but you should be very cognizant of your health. Please reach out to your doctor, take your temperature, be very cognizant of any symptoms that you have. The second case was someone who was traveling from New York City to I believe, Binghamton. If you're traveling, they stopped here in Syracuse. You could have been on that bus. You got off in Syracuse. If you're on this bus, and let me give you this bus again, 0206. It left the Port Authority in New York City at 2:30, arrived at 7:40 in Syracuse. If you're on that bus, we're asking you to self-quarantine and contact your doctor. Okay? Any other information related to any of these releases, you can get at www.ongov.net/news. Look at related to social distancing, physical distancing, whatever you want to call it. We have to live with it. And certainly we're going to have more information on the community spread that we're seeing. And we're going to share examples with the community so they can be cognizant and a reminder that the virus is here and doing things that are very well-intentioned could lead to positive cases. So we'll certainly, as our health department breaks down more data, we'll certainly be sharing more examples of that. Again, when we're starting to see trends, when you have nice weather, you have more cases. It takes about 7 days. It makes sense. So when you're out in the public, you just need to be cognizant of that and try to protect yourself, protect your family. But we'll share more data with that tomorrow and Tuesday as we understand more what it says. Certainly on a restart, we've talked about it. We understand more what the governor's looking. We've put forward some of our restart plans and strategies to the state of New York. We're having communications. We believe we are well positioned for a restart. When you look at all of our data, whether it's how we've performed related to death rates, when you look at testing rates, we are the best region that has a Big Five metropolitan city. We're the second best in the whole state. So, even though these numbers are concerning that we have more positive results, where are we supposed to go from best to best? So so I think when you look at these, this is about not getting sick, and this is about if you get sick, you're going to be really sick, and if you get sick, your loved ones are going to be in a quarantine for 14 days, and you could be out of that. So this is about saving life. It's about being cognizant. Certainly, these numbers aren't going to slow down or restart. But if you get too comfortable and the numbers get really, really high and hospitalization rates jump, that can be a problem. So we just need to be cognizant of this. The virus is still here. We need to learn how to live with it and react and respond, and we'll do it. Upstate triage hotline. When we look at the hotline, this is for folks who need to get tested. They have symptoms. They want to get screened. 315-464-3979. When we look at seniors, healthcare workers, and adult nutrition hotline, 315-218-1987. Again, call this line if you are having a situation you can't get to the grocery store, you need help, you need a meal, you've never been in this position before. Call this line. It's amazing the amount of different folks we help in different ways with this line. A lot of masks have been given away now. Again, we have masks. If you need a mask, reach out to us. No excuse to go to a store. If you need a mask, we have them. It's about protecting your neighbors as much as it is yourself. Certainly when we understand people with respiratory illness, asthma and whatnot, having these on is problematic. We get that. Child Care Solutions, 315-446-1220. This has been our continuity of care plan that we've had for essential businesses. We've serviced hundreds and hundreds of families through this. Again, we've extended this through May, free of charge to our essential business employees. And 211 for social and emotional support. Certainly, the reality of this virus is taking its toll on folks. Again, a tough week related to closing of schools. Certainly, I know our teachers are disappointed. Our students are disappointed. If you need help, call 211. Again, 211, I think since March 17th, has taken over 13,000 calls to help people who need help. Saying that, I will take some questions.
Can you clarify the numbers and the new cases with nursing homes and contact cases? Can you run through those again?
53 new cases. 19 of them are related to either assisted living facilities or nursing homes. And 12 are related to household contacts. So we are left with 22 community spread.
Do you have any numbers with the Walmart testing site? Obviously, you guys have robust testing for nursing home facilities, patients, and then also the employees as well.
We received tests back from Walmart, and I think our positives we received are like 23, 24, 25 total from them, not in one day, just total since they've done testing. So what we've seen from our Walmart site is the proactive testing of asymptomatics. When you add that in with the way that they get screened, the rate at which they're positive out of that site is a lot less than everywhere else. You're screened to CDC guides by either a doctor or a live caller on the triage line, and then so that's how you normally get tested. Our proactive testing, remember, we're not proactive testing neighborhoods. We're proactive testing areas that we know there's problems and where this virus is there. So when you look at who we're proactive testing, we're proactive testing the spots where the highest probability of finding the virus. What will eventually happen is as we implement proactive testing throughout the community to meet the state's mandates of monthly testing, we'll probably see that those percentages start to drop similar to the Walmart site because it will be more random and not more surgical.
So where the problem sites are in terms of the nursing home facilities or the senior living facilities, I guess what happens next when you find those positive cases?
Yes.
What happens?
So you essentially work with, first off, if they're an employee, they're going into a quarantine and they're not working, right? So they're going to go into isolation, and then they need to recover. Most of the nursing homes have either a dedicated COVID floors or some sort of infectious control plan now, and the state health department and our health department have been working a lot with them. They're more prepared now than what they were. So again, if you're COVID, if you're asymptomatic, or if you're sick, they'll go and they should be isolated at the nursing homes. Much easier to do. Now, what has happened, and why I talked about this with the hospitalization rates, some of these nursing homes are not necessarily knowing how to respond with certain individuals. We've had asymptomatic nursing home residents going to the hospital. There's no reason for them to be in the hospital. So this just happened over the last 3 days. So we're going to work that out, and we're going to help these, give direction on what should happen. We don't need, just because somebody's asymptomatic of COVID or they're light symptoms, they shouldn't be in the hospital. They should be isolated. They should be being taken care of and checked on. So we'll work that out. But if you took out those types of people from our hospital numbers, they would be down probably more than the 5 that they got added.
Mm-hmm. Going off of that, my coworker, Anthony, he had a good question, and I want to obviously give credit where credit's due. But he and all of us are curious. So with the proactive testing at the nursing home facilities, how many people do you think are living with this coronavirus if there weren't proactive testing? And then going off of that, in terms of a restart, should we be slowing down that thought? I know you mentioned briefly that we shouldn't, but let's say more cases come up. Would that hinder that?
So let me ask Anthony this question. When you're the best region in the state, and you do proactive testing and you find asymptomatic individuals, how do you slow down a restart? You're the best. Where are you supposed to go? Be the best again? So unless the whole state's going to change, it's just not merited. The reality is our 0.22% of our residents have been confirmed testing. The antibody testing that the governor's using shows it gives you a different number, but our number is 1.9 for Central Region, second best. The North Country is the only one better than us, 1.2. They don't have a city the size. They don't have the population we have. So how do you suggest? We've been lucky because we've done so well with this, and that when we would see cases, positive cases, and they're 21, 27, 15, 13, 20, 25, we were like, geez, these are bad. And then we went lower. But the reality is those numbers are so much better than everybody else. When you look at the rest of the state, we just have gotten used to these numbers. Now our numbers are still there. Remember, we weren't getting nursing home cases for the first 5-6 weeks of this. This has become a problem, or assisted living cases recently. So where do you, on a restart, where do you go? I mean, we're implementing what the governor's asking every community to implement as part of a restart. We've already done it. So how do we get better? The only thing in these numbers that I think we can be a little bit better at is we got to be more cognizant as the weather gets better and we get together more about following physical distancing, being smart, putting ourselves in a position to succeed. There's not going to be any more nursing homes or assisted living facilities to test after this. We're almost done. So all those positives are coming. There's nothing else. So what's going to happen is you're going to have new proactive testing in a way. If we see a problem somewhere else, we're going to go try to find it. Or you're going to have random proactive testing, and those numbers will come down. But the community spread is what is the intensity in the whole community. We've had 2 more days that were higher than the 7-day average last time. Too early to say we've lost ground, but if you track back 7 days, you had 2 sunny days. So related to restart, I don't know how you can say to Central New York, we're not ready to restart. Our hospitalization numbers are fantastic. Our capacity is fantastic. Our ability to track down and trace the virus is probably better than any other communities. So then when you go at the proactive testing that you need to do, we're already doing it. So when you take all this in, when you do proactive testing, you're going to find it, 8%. You're going to find 8% of the tests until you're doing it completely random, then I think the percentage will drop down.
In regards to hospitalizations, one of the requirements to start phase 1 is that it has to be on the decline. Having 5 more, does that concern you that May 15th won't be the date?
No. Our peak number, I think, was 55. We already met that threshold to allow elective surgeries. Those five folks that went in the hospital shouldn't have gone in the hospital. And it's actually more than 5. It's specifically the issue of how nursing homes were handling patients that aren't sick enough to go to the hospital. They sent them there. So including people who are asymptomatic. They're not even showing symptoms. So that's what that 5 represents today. The reality is you need a 14-day decline from your peak. And we already met that threshold. And we have as much robust hospital capacity as anywhere in the state. So I'm not concerned about that. I'm more concerned about making sure that as we get going, that we're being smart about how we interact with each other and we protect ourselves, because what's happening is that the contact cases are a little bit more, percentage-wise, they're still at 10%, right? But what we're seeing is some of these, if you get COVID, you're in a house, you got 4 other people in the house, you're supposed to isolate yourself from the rest of the house to try to avoid them from potentially getting it. We're getting a little information that we aren't doing that as well as we're supposed to do. So when you go through this process and you see things that you wish, kind of unforced errors. If you think about a sporting analogy, it's an unforced error, it's a turnover. You're going to have these. So, we just got to be here to remind the public of, the risks and make sure that everybody's doing their best to mitigate those risks in their own lives, for themselves and for their families.
The governor announced today that hospitals have to be stocked with a 90-day supply of PPE items. Are the hospitals in our region, in our county, are they prepared with that?
Yeah, we're getting better. I think by May 15th, there's more and more folks that are in this business now. So it's getting better. It's still very competitive to get your hands on this. But certainly the hospitals have had to ramp up their purchasing because they want to do elective surgeries again. So that's going to require PPE. So we're getting there. I think we'll be there, if not close.
Also, with testing, when I was driving here, I saw that at the Harrison Center Pharmacy, it looked like they were setting up a testing site. Do you have any information on what that is down the road?
Yeah, the state has partnered with many of the pharmacies now to be another resource to do a swab test. So I'm not sure exactly how they're all going to roll out in the timing, but you may have got one of the first ones there. Certainly in our community, there's many places to test, and the hospitals are doing testing. You have Walmart, you have the triage site at the Syracuse Community Health Center. You're going to have pharmacies coming online. They have sites in Madison County, Cortland County, Cayuga County, Oswego County. So if you are symptomatic, you'll get a test. Your primary care providers all have tests. Now, with this new restart, all of us in Central and Mohawk, when we get going, are all going to have to do proactive testing in our own community. So there's going to be a boatload of testing, which is good. That's how you got to find it and find these hidden pockets. These folks who are asymptomatic they're not sick. They shouldn't be going to the hospital. They should be isolated, and so that they can't spread it in a quarantine. And so you're going to find a lot more of these asymptomatic cases, and whether they can spread it or not, we don't know enough about it, but we're under the assumption they can.
So that's a state partnership. Do you know when it's supposed to be active and open?
I don't. I think they're going to a boatload of them are going to come online as the test gets become more available in the overall marketplace, and they are.
Ryan, we've been getting a lot of calls about garage sales. What's your stance on that?
Yeah, my understanding is, they shouldn't happen, and I know that there's some big ones traditionally this upcoming week. I think the Radisson community has a really impressive, robust garage sale every year where they get a lot of folks coming in, and it's the type of thing that if you look at the spread, it seems harmless, right? And it is harmless. No one's trying to do anything wrong, but you put that many people together, touching things, looking at things, could be a problem. And so my understanding on garage sales this past week, I think it was addressed that they shouldn't be happening.
I know it's still a few weeks off, but your best guess, what things would be opening on May 16th?
So I think, and again, we're exchanging some thoughts and ideas on this right now, but certainly you got to open up construction. You can do it safely. Folks can be wearing a mask. Manufacturing, and somebody sent me an email, some construction is going on, some manufacturing is going on, not all of it. But that brings back, a bunch of people to work and proven areas where you can physically distance. Home building certainly falls under that. I think you loosen up guides on landscaping, things where it's easier. Is there a way to look at specific health-related type practices, eye care, dental care? Everybody is asking about salons, barbers, haircuts. I get it, trust me. But that's a little bit more complicated. We're getting feedback from a lot of these business owners who are saying this is how I could do it, and we're talking to the state about it. So we're hopeful that later this week we'll be able to have a better idea as to what that looks like specifically to different industries. And we're mindful that what we do here is going to be the blueprint that they do throughout the rest of the state. Most likely, I think there's 2 or 3, maybe 4 regions that can probably get going, earlier than others. So certainly we're one of them.
Got one more. Somebody had asked about libraries.
Yeah, so that's kind of our call. So we're looking at that. We're going to evaluate libraries and probably have a decision on when they get open up next week.
Regarding the passenger who tested positive on the Greyhound bus, you mentioned that that person isn't an Onondaga County resident. Can you disclose where the person may be quarantined?
Yeah, I think they're in Broome County, is my understanding. So what happens is, if you have specifically inter-county travel, and these tracers, so Broome County gets somebody, I think they go and test them. They trace, where were you? I was on a bus. Where did the bus stop? Boom, boom, boom. They then contact our health department. Then we then try to do tracing to figure out who could have been exposed on that bus from Central New York. And then if we have a gap, we let people know. So that's how that works. Not a county resident. They were wearing a mask. They're on a bus, kind of confined. So good idea to self-quarantine if you're one of these individuals. Watch your symptoms. Call your doctor. See if your doctor thinks you need to get tested. If you do, we have a bunch of spots that you can go.
With the talk of a possible phase 2, are you concerned that if you have to enact the social distancing rules, the stay in shelter-in-place orders again, that people will just not follow them, especially with summer here now? So
the key, and this is why look, there's a phase 1. We want to get going on phase 1, right? We can do it. We can do it safely. We can prove it. Phase 1's easier because we already have kind of a proof of concept with businesses that are operating now. We're just bringing more people into the equation and maybe loosening up some things. There will be a 14-day pause between that and phase 2. And the state and the county agree on that. So we know that will happen. Why do we need 14 days? We got to sit there and analyze what happens and look at what happens. And then once we're comfortable that we can track the virus essentially in real time still, then you move to phase 2. And again, you've heard the governor talk about 1.1 infection rate, and that's kind of when you got to slow things down. That 1.1 would be off of our 4, how many active cases do we got here? 401 cases. So if we had 1.1 of 467,000 people, you're essentially at 5,000 cases. So if we had this is a good question to your question earlier, Adrian, with Anthony. If you have 5,000 active cases in Onondaga County, everything stops. We got big problem, right? Because your hospitalization capacity is gone. Your rates are going to be jumped. You have a big problem. We're at 400 right now. And mind you, out of that 400, 280 of them are essentially senior related. And they're going to be active for 14 days no matter what because of our new guidance, whereas others can come off after 7 days. So we're not even close to being that problem. But yes, if you have a situation where you're seeing all of a sudden we're putting back more people into the workplace, we see boatloads of new cases, our health department's having a hard time responding in real time, it's going to take us longer to get to phase 2. It will get there, but it's going to take us longer. So the key is it's about our own health. Think about it. If you don't want to get sick, just be smart. You know this thing can spread through saliva. You sneeze, you cough, it hangs around for a little bit. Be smart and wash your hands. Because if you get sick, there's a good probability that people in your household are going to get sick, and everybody's going to be in a quarantine for 2 weeks. So if you don't like this quarantine we've all been living through, let's just take care of ourselves going forward as we get out of it.
Are you concerned, though, that let's say you open salons and you see the number of positive cases start to increase again, and you say maybe salons, we should close you back up for a little bit. Are you concerned that that people would just not even abide by it, that they would say, we did it for a month and a half, 2 months, you let us get a taste of what it's like to be reopened again, and now we have to close back up?
That's you hate to deal in hypotheticals like that, but you that's why you crawl into it, because with each phase you know you're going to get more positives for a while, unless it behaves like SARS, right? If it behaves like SARS, it's going to go away in the summer, and then it could come back. So the thing with salons, barbershops, a lot of close contact, there's going to be guidelines on wearing masks and different things. Certainly part of what these trackers are going to be looking at, people are concerned about the risk there. So that will be tracked very closely, and you'll have more trackers doing that. But part of this is you probably can't shut down. So that's why you're so conservative when you go into the next phase. You're not going to get into phase one and then shut down phase one because you see an uptick in cases, unless you get outbreak in the community. Then all bets are off, right?
A lot of restaurants are open for business, open for takeout, but some aren't. Any idea of restaurants, what phase would they fall in?
Yeah, restaurants are complicated because, again, you got to look at how do you operate the back of the shop and the front of the shop. So certainly they're not a phase one. They're open now for takeout. Actually, phase one might actually be helpful for their business. More employees coming out, more people wanting to eat lunch. They can get takeout. Your margins might be better for those restaurants before they bring back a lot of people. But certainly when that's more of a phase two than potentially phase three, call. And so it's a sweet spot for restaurants. You takeout business increases, that's good. Bringing back more employees just to do takeout, probably not as likely. So then phase two, if you have this is a hypothetical, but people have thought about this. If you have only so much capacity with the restaurant being open, how many more employees can you really bring on? And does it make more sense just to stay at takeout only? So if it's a phased-in restaurant schedule, you may see some restaurants just stay with takeout until they can come back full staff.
And then would hair salons fall in phase one or phase two?
I'm not sure. I don't know if phase one's likely with that. Again, we'll work with the state on that, but I don't think if we're going on May 15th, hair salons will be ready on May 15th.
I missed the part about the Walmart gap. Was that just one case, or were there more?
We've had a couple different gaps with Walmart this past week. This is a new one. So this is an individual who shopped at Walmart April 28th, 10:30 to 11:30. They did test positive. They were not wearing a mask. That doesn't mean you had direct contact again, but certainly we want people to be cognizant of that and their health. And I think everybody is. With this weather, look at it's good weather this weekend. Hopefully everybody's doing the right thing, and we won't see an uptick of cases a week from now. But it's going to become more challenging. Kids haven't hung out with their buddies in a while, and we're just going to have to figure out to live with this virus and be smart and really look out for each other, because you don't want to go backwards. If you can't handle the quarantine now, being in quarantine because you're sick with this thing's a lot worse.
You mentioned, obviously the weather's awesome this weekend, and with that, people are going to the parks and going outside. Is the county doing anything else besides obviously limiting the number of people that can park there? You mentioned that the county has masks. If people need masks, they can reach out. Are you guys handing out masks at parks or doing anything else besides just limiting the cars that can come?
Yeah, we haven't done masks at parks. Really what we have is our park rangers. We're limiting traffic patterns to it's a way to communicate, when you close down parking lots. If you're on the parkway and one of the parking lots is closed, you can go on the Hyde side, across from Hyde's, our main entrance. If there isn't any parking there, we want you to come back. We don't want you to be there. But that's on Onondaga Lake Parkway. But that's one way we're doing it. We've given out thousands of masks the past week. And so to various businesses and entities, and we'll continue to do that. So if folks need one, this is what they look like. They can get one, and we'll get it to them. So that's, the reality is we want people to be smart especially when we go into this restart, even if it creates some more work for my office as they're cringing as I just said that online. We'll get you masks if you need masks. We'll figure it out. Other questions? Okay. Last Friday, we thanked many of our partners that have helped us be very successful today, really with the needs of the community. Again, I want to thank these organizations, the Rescue Mission, Syracuse University, Lemoyne College, OCC, and the Grace Assembly of God's Church. They've been helping us with continuity of food planning. At one point, toilet paper was a serious stressful issue here in our community. Syracuse, Lemoyne, OCC helped out big time with many supplies throughout that. And again, I just wanted to thank all of our teachers, specifically for the work they're doing with their continuity of learning with the kids. I know how disappointed you are that the school year has ended early, and I know you still have to work. And so, again, I want to give a big shout out to our teachers and our educators and our students as well. And just thank everybody and encourage everybody to continue to be safe. We're getting through these processes. We're going to have good days and bad days, but we're getting through it, and we'll be stronger at the end of it. So thank you.